Hey folks, you are here with Ron and Nick once again. Today we are hitting a topic that's probably at the forefront of your mind when you actually have 5 minutes to think about it, and that is the future. Master planning in healthcare is a critical step to understanding your facility needs and what is going to come in the future. And to do that is a multi-step process and can be really interesting.
Right, it's kind of one of the most exciting kind of points when you're starting a new project is kind of just thinking about the different needs that you have. You kind of are starting at your most ideal situation and then working backwards from all the different parameters that you have in your head. You know, can I afford this? Do we have time for this? Is this something that our staff needs, or is it something that our patients need?
Today we're going to talk a little bit more about your campus or your network, if it's multi-hospital network. And we've had quite a few cases lately where we'll go out and visit a multi-campus network and provide a spreadsheet that in the end, you as a facility director or someone in that field can take to your board and say, this is kind of what we're looking at for 1 year. This is kind of what we're looking at for 3 years. And here's maybe the big picture. And that's going to help you prioritize.
Right, because a lot of this strategic planning requires a lot of analysis, you know, and it takes a lot of information from a lot of different people because so many different people have so many different needs. So you really have to, you know, look at the big picture of things to figure out, you know, what you can start to tackle and what will be the most impactful for you and your team.
So how do you kind of go about doing a facility kind of needs assessment?
So one of the things that you do is you hire an architect to survey your existing spaces that you have already, because in order to improve upon what you have to kind of know what you already have. What would you do from there though, Ron?
So we're going to come in there with a team. We're going to look at all your facilities, and we can do other things as well. You know, look at handicap accessibility, ADA issues, adjacencies. As part of your master plan, you want to think big, and then you find out what really become your priorities, the dollars attached to those priorities, who's going to be able to hopefully provide some funding for that, and put that list together. We'll sit down with you. We'll prioritize that list and work with some of our friends and family and the CM side of the world.
There's a lot of phasing involved, which is why we like to bring CMs on board early,
right?
So that we can get not just the pricing in line, but also, you know, the timeline of how we want to accomplish it.
So have us come in, have a conversation. We can do it virtually to begin with, but really in the end, it'd be great for us to walk a building with you. And you're going to point out, because you're going to know all the skeletons in your closet, you're going to point out what issues you have. We'll probably discover a few issues along with you, but we're going to help you solve it.